Hello guys, welcome back to the MD Investor, the channel where we talk about personal finance, increasing our financial IQ so we can break the cycle of generational poverty. Today's episode is going to be a continuation of our series all about FIRE, Financial Independence, Retire Early. We did a couple of previous episodes. You can go to the channel and just type in FIRE. We put it in a playlist. Today's episode is going to be about medical insurance. What do people in the FIRE community do about medical insurance? It's a big deal, it's a big topic, because we know that catastrophic medical occurrence can bankrupt you. And we know most people get their health insurance through the employer. And Medicare doesn't take effect until age 65. So if you're retiring from your job at 40, 45, and Medicare doesn't kick into 65, you see there's a big gap there where you are without insurance. So that's why it's a very important topic. So let's get into it. The first thing you will probably hear as you're researching YouTube and Google and all that would be COBRA. Not COBRA the snake, but COBRA, the Consolidated Omnibus Budget Reconciliation Act, which basically means the insurance you had with your employer-sponsored insurance, can be continued after you leave or separate from service. You have about 60 days in which to make that decision. And the insurance will last, they'll cover you for about 18 months. In a couple of exceptions like divorce and disability, it can last up to 36 months. What you will also notice is that you'll be responsible for 100% of the premiums. Previously, while you were working, you'll be responsible for a smaller portion, and your employer will be responsible for a larger portion, at least 50%, but a lot of times more. So, you were paying maybe 20%, they probably pay 80%. Example would be if you have a plan to cover your family, you may be responsible for only maybe $200 a month, and after you separate from service, you may realize that your premium is probably $1,000 or $1,200 a month. Why? Because the portion that your employer was paying, they're no longer paying it, because you're no longer an employee. Everything else will stay the same, your doctors, your hospitals, and all that stuff. But something to consider. It's called the COBRA plan. And whenever people leave jobs, they will mail you out the information. Number 2 would be part-time work. I know this is the FIRE movement, and everybody want to be, free and do what they want to do, and quality of life and all that stuff. But if you can find a part-time job working, 15, 20 hours a week, and part of the benefit is healthcare, that's something to really consider. Right? As we said, a medical catastrophe can bankrupt you. Especially now in light of the Great Resignation, where employers are really looking to, try to recruit people. They may be willing to give you health insurance. Number 3, I would say, would be spouse. If your spouse works and have a good job and good insurance, and your spouse and the dependents are also entitled to insurance, right? So that's the situation I'm in, and that's something I just want to mention. If you have, number 4, I would say, if you have a small business, okay, whether you are an independent contractor, you're a 1099 worker, Uber worker, you have a home-based business, you could provide insurance for yourself when you're self-employed. You don't have an employee, you're self-employed. You can pay for private insurance, and it is tax deductible as a business expense through the business. So that's something to consider as well. The other option for health insurance for the FIRE community, we'll jump in the computer. I'll see you in 1 minute. In my computer. As we said, we're going to continue with a few other options for healthcare insurance for people who retired early, right? The next option for people who retire early is private insurance, right? Just because you are retired early and you no longer have an employer, there's nothing that says that you can't provide private insurance and go buy it for yourself, okay? One option would be if you were to get a healthcare broker who's going to negotiate on the on your behalf with all the different carriers, Blue Cross Blue Shield, Humana, Anthem, all of that. Obviously, that's going to be time consuming and it's going to be very annoying. The other option would be to have to do it yourself. You making a phone call, calling out and negotiating and so on. The problem with that is that it will require medical underwriting, so blood test, physical examination, and so on. The other option would be if you were to have the go into what they call the ACA or the Affordable Care Act, aka Obamacare, where the government provide a marketplace, and that's what they call it. You enter into the marketplace, and let me add this: it is private insurance. It is not government insurance. It is private insurance. It's just that the government is kind of securing the leveling the playing field so that they can't deny you with pre-existing conditions. Okay, so if you have COPD or asthma, they can't say, okay, we're not going to cover you. So they have to cover you. Like I said, it is private insurance, but there's a certain income. If you're below a certain income threshold, the government can subsidize some of your premium. So you can become eligible for a premium reduction if you meet certain income threshold. There's a couple of points here. So it is government subsidized healthcare, but it's private healthcare. If you meet certain income criteria, you can be qualified for the subsidy. If the healthcare marketplace that the government provides, the insurance companies have to take everyone. They cannot charge you. Of course, they cannot say they're not going to cover you if you have pre-existing conditions. And what you're going to come across is the different metal tiers: bronze, silver, gold, and platinum. Basically, all these tiers mean is that it tells you the split between what the insurance company is covering and what the individual is covering. For example, in the bronze plan, it's a 60-40 split. So the insurance will cover 60% of your medical expenses, and the individual will cover 40%. The gold is the silver, it's the 70-30 split. The insurance company covers 70%, the individual covers 30%. The gold is the 80-20. The individual covers 20%, and the insurance company covers 80%. And of course, the platinum is the 90-10, where the insurance company covers 90% of the expenses, and the individual covers 10%. What you also note is that the higher you go up in a metal tier, is the higher the premium, which makes sense, right? Because in the platinum plan, for example, if the insurance company is covering 90%, of course your monthly premium is going to be higher. So that's something to keep aware. Now there's a open enrollment period annually between November 1st and December 15th every year. Okay? So every year between November 1st and December 15th, you have an opportunity to apply for healthcare. Now, what happens if you miss this? If you miss this time and you need healthcare? For example, there's something called the special enrollment period. For example, you have a life-changing event. You got married. You had a baby. You adopted a child. You can then be eligible within 60 days of the life event of applying for health insurance. Now let's get back to the premium tax credit eligibility. Like I said, you're eligible for your premium to get a tax credit for your premium if you meet certain income criteria. What I've come across is 4 times the federal poverty level. So let's look at the poverty level, and then we will do a quick example, and then we'll be out. So here's the federal poverty level. For an individual, the federal poverty level is $13,590, right? According to the research I've been doing, if your income is below that, you're eligible for a tax credit or subsidy for your premium. And you see this is the 2021 numbers. And because of inflation, it's a little higher year over year. Look at a family of 4. Family of 4, 2022 income numbers is $27,750. So if your income is no more than 4 times that, which would be $111,000, you should be eligible for the subsidy for the premium. Now let's do a quick example here. So first thing you're going to do, you're going to go to the healthcare.gov website. We're going to put a zip code here. You're going to activate your zip code. That's Philadelphia 19019. And we're going to put in a couple of fictitious birthdays. So the perfect birthday is January 1, 1985. And we'll give him a spouse or her a spouse. Same birthday, January 1, 1985. And we'll give them 2 children, okay? They don't smoke, which will probably increase your premium. And they're not Native American, which may give you maybe a subsidy of some sort. Let's look at, give them 2 children. Birthday, January 1, 2021. And we'll give them another child, January 1, 2022. And then we're going to go down to where it says annual tax household income. Let's make the tax income $100,000, right? Let's do $100,000. And then it says here, see if you qualify. So we'll hit that. And it says here that for a family of 4, right? It said what it's saying here that we estimated tax credit of $574, which means that we'll be eligible because of our income we're eligible for $574 in tax credit, right? It says what we should be paying is $1,235. So we'll be saving about 50%. So what we will be, our monthly premium will be $661. Now what we're gonna do is go back and change the income to make it above 4 times the poverty level. Remember, a family of 4 times the poverty level, we said would come to about $111,000. So what we'll do, we'll make it maybe $112,000. We'll make it $112,000. And then we will see if we qualify for $112,000. And it looks like we still qualify. Our tax credit is less than before because it's income driven. But we have $441 in tax credit you're saving every month. We should be paying $1,235, but we save $441, and our monthly now $791. It's still higher than before because our income is higher. But this is kind of go to show you because what my research had showed me that 4 times above 4x times the federal poverty level will cut out all your subsidy. But apparently it does not because we're still getting a subsidy. And again, it shows you that things change, right? Year to year, laws change and things change. So you have to do your due diligence, do your research to kind of see how it is in your state. Now, the other thing I would mention too that maybe Medicaid could be an option, right? Medicaid is state-based, right? So obviously you have to do your due diligence, and they will have a income threshold which you have to be below. Okay, obviously if you're above that and you have certain conditions like blindness or pregnancy or certain conditions, you have to spend down to get below that threshold. Again, you have to do your homework and due diligence and so on. What I came across here in insurance for early retirees is that one is complex, and you have to do your homework, and it's really individual based, right? For example, if you're a pretty healthy person, you may not need a higher level, meaning you may not need the platinum plan. You may do something, like the bronze, maybe with a higher deductible because I don't go to the hospital that often. But to quickly recap, and then we'll be done. COBRA. So you separate from your job, but you are still eligible to maintain the insurance. The premium will all be on your shoulders. It only lasts for about 18 months, with some exceptions. Part-time employer. Some employers will give you insurance, and that's a great thing. If you're married and you sponsor the job, then you'll be eligible to be on their insurance. If you have a small business, you can buy private insurance, and then that'll be tax deductible. You can also do private insurance. You could go through it yourself, meaning get a healthcare broker and try to do it that way, or you can go through the healthcare marketplace through the Affordable Care Act, aka Obamacare, and we kind of went through that detail. Again, guys, that's all I have for you guys. You see that this took a lot of work and research and stuff, and obviously we can still go deeper in it. So this is something you have to do your own due diligence and research and make your own decision based on your individual situation. So until then, guys, continue to command your money to grow, and I will see you on the next one. MD Investor out.